Good day. In today's demo, we're going to demonstrate capillary blood glucose. This procedure allows us nurses to monitor and determine the blood glucose of the patients at risk of hyperglycemia and hypoglycemia. Of course, this promote blood glucose regulation by the client, and of course, this evaluates the effectiveness of the insulin administration. And of course, before implementing the procedure, we must assess the blood specimen according to the hospital policy, according to the agency's protocol, the frequency and type of testing, and of course the client's understanding of the procedure and the response of the client from the previous testing. And of course, we must assess the client's skin at the puncture site to determine if it is intact and the circulation is not compromised. Of course, we must also not forget to check the color, the warmth, the capillary refill of the finger there. Of course, we must not also forget to review for patient's medical record for the medications that may prolong the bleeding, such as the anticoagulants, the medication, the medical problems, and the increased bleeding response, of course. Of course, we must not also forget to assess the client's self-care ability that may affect the accuracy of the test results, such as the visual impairment or the finger dexterity. For the planning, of course, we need to review the type of meter to be used according to the manufacturer's instructions and assemble the equipment at patient's bedside to save time and effort. Introduce yourself to the patient, of course, to prevent him being anxious about what's going to be performed. And of course, explain to the patient why this procedure is necessary and the purpose of it. So now that I have explained the procedure a while ago, we will now continue. Perform hand hygiene by the use of alcohol to prevent infection. And of course, we must also not forget to provide for client privacy by closing the curtains, the doors, uh, to prevent there, and prepare the equipment, essential equipment there. Then of course, we will now prepare the equipment, which is the gluconometer. Some meters, when a testing strip is inserted into the meter, turn it on there. Then after, uh, apply clean gloves, of course, as this procedure will after applying the gloves, select the appropriate site, prepare the vascular puncture site. Choose a vascular puncture site, the side of the adult's finger, and avoid the sites with bony, such as the bony prominences and the uh, middle of the finger there. Then after, of course, we will uh, wrap the finger first in a warm cloth to prepare the the site of injection there. Then then after, of course, we will uh, cleanse the site with the use of alcohol and the gauze pad and allow it to dry. we must allow it to dry to prevent stinging of the when we will prick the finger there. Um, Also, of course, this procedure or this cleansing of the finger allows the blood circulation to flow, and this will also ensure that the adequate specimen will be um, appropriate and will reduce the need to repeat the puncture there. Of course, we must now obtain the blood specimen by placing the injector to the side of the finger there, and of course, release the needle. Uh, Encourage the patient to relax and breathe in, and make sure that the lancet is perpendicular to the side. This lancet will pierce at the skin once it ha to the skin at a specific depth, it and if it is in the perpendicular position there. And then after, of course, gently squeeze the finger, and also do not touch the punctured site, as it will contaminate uh, the blood to uh, this specimen. Then after, of course, drop the first blood and wipe it using the swab or the alcohol swab, and do not smear the blood. Now that you have wiped it already, uh, place it on the here on the wick. And do not smear the blood. Smearing will cause inaccurate reading there. There. Then after, apply ask the client to apply pressure onto the punctured site, so as to uh, promote hemostasis. Then expose the blood to the test strip for the period and the manner specified by the manufacturer there, and follow the manufacturer's recommendations onto on the glucose meter, and the monitor for the amount and time when the blood is placed on the test strip there. Then after, measure the blood glucose, place the strip onto the meter according to the manufacturer's instructions, and after that, it will now present the results onto the screen. The correct timing ensures the accurate results. Then after you have uh, acquired the data, you may now turn off the meter and discard the strip onto the appropriate trash bin, together with the uh, gauze pad in a biohazard receptacle, and discard the lancet into the shards container. Now, and remove the and discard the gloves to the appropriate receptacle, and of course, perform hand hygiene. Of course, before and after the procedure, we must not forget to perform hand hygiene. Now for the evaluation, of course, compare the glucose meter reading to with the normal blood glucose level status of the puncture site, and of course, motivate the client to test independently, as this procedure is only takes for about 2 to 3 minutes, 5 minutes at most. And of course, relate the blood glucose reading to the previous readings and the current health status of the client. Of course, for the documentation, document the method of testing, the results of the record, uh, and of course uh, the client's record, of course the flow sheet, and which the capillary blood glucose results and the amount of the type, the route of the injection, and the time of the insulin administration. Of course, check for the diabetic flow sheet if it is being used for the client, and check for the orders of sliding scale, insulin, and based on the capillary blood glucose results, and administer insulin as required. So there, now that we are through on the procedure, thank you.